Hello and welcome to the Warrior podcast. In today's episode, we have a special guest. Dr. David Spiegel is a professor of psychiatry and behavioral sciences at Stanford Institute in the United States. He has more than 40 years of clinical and research experience, has published multiple books, more than 400 scientific journals, and he is the founder of the world's first interactive hypnosis app called Reveri. In today's episode, I spoke to Dr. David about hypnosis, how it has been misunderstood to be just a magic trick, how it can be used in clinical medicine to help patients with many different kinds of disorders like addiction or chronic pain, and how self-hypnosis is being accepted to be a valid treatment option. I hope you enjoy this conversation, and if you have any questions, leave them in the comments below and I will try to take as many as I can. I'll see you at the end of the episode. Dr. David Spiegel, thank you so much for joining in. It's my absolute pleasure to have you on the Warrior podcast. On this channel, we talk about neurology, neuroscience, and we try to connect it with other fields like philosophy, religion. Very
Great.
happy to have you here. Thank you, sir.
Happy to be here.
I wanted to start this discussion by sort of clearing the air about hypnosis. There is a lot of misconceptions. There's a lot of preconceived notions that people have about hypnosis. And especially where I'm from, which is in India, hypnosis is being traditionally associated with magicians, magic tricks, mentalism. So
Right.
I wanted to ask you if hypnosis as a subject, how has it evolved over time? Was it always meant to be a medical topic, or was it initially something else?
Well, it actually started out as the oldest Western conception of a psychotherapy said. The first time a talking interaction between a doctor and a patient was thought to have therapeutic potential. But somehow, because a number of the leading pioneers in hypnosis wound up having serious and damaging confrontations, it got left to magicians and stage show hypnotists and things like that. So it's sort of like what would have happened to pharmacology if snake oil salesmen were the only ones left pushing drugs. And so Franz Anton Mesmer, who was a Viennese physician in the 18th century, first got the idea that people could change their state of concentration, their state of mind, by being juxtaposed with a tub full of magnetic iron filings, magnetized. And he called it animal magnetism, that it would change the magnetic flow in your body. And people would go into altered states, women would faint, and many of them actually felt different. They felt better after they went through this rather strange thing. So Mesmer became very well known. He left his wife and family in Vienna and moved to Paris. And there he competed very successfully against the leading French physicians of the day. And yet it has taken us a long time to recognize that the brain is actually a remarkably efficient control center and can help us manage pain, stress, anxiety, insomnia, eating, smoking, all kinds of habits can be controlled, and we just don't take full advantage of it. So hypnosis has been sort of relegated to be a sideshow, and that's a shame. And I've decided in creating Reveri, I decided I wanted, I'm tired. I've been doing research and publishing randomized clinical trials and studying what goes on in the brain with hypnosis and training doctors to do it. And I'll keep doing that, but I've decided to go direct to consumer, to the people, and say, you can learn to use this and you can help yourself. That is, get on the team and help yourself control many of these problems that are making your life worse. You can make them better. Yeah. And so one of the sort of strange misconceptions about hypnosis is that you lose control. People have this idea that some weird guy can take over and make you do anything he wants. Now, we are social creatures. We are unduly influenced by all kinds of people. And just look at American politics and you'll get that impression. But hypnosis is really a form of gaining control, not losing control. It's one of the big mistakes about it. And so it's an appreciated resource, and it's something that can be used with great effectiveness by a lot of people to help themselves live a whole lot better.
Absolutely. I think all doctors who are in clinical practice at some level know the power of suggestion, know the power of empathy, of having your patient trust you. They know the power of how saying something positively can impact outcome. So I feel that at some level everyone understands this, but labeling it under hypnosis seems to be where people get stuck.
Right. And it's a shame because hypnosis simply intensifies. It's not, the placebo effect is important, people feeling reassured that something good will happen improves the likelihood that something good will happen. But hypnosis is more powerful than that. It's a state of mind where you can intensely focus, you can dissociate, put outside of conscious awareness things that would be in consciousness, and you can um, change your view of who you are. You can try out being someone different and see what it feels like. And you can do that in a matter of minutes. It's not a big, long procedure. And so it provides opportunities for change that are very valuable and underappreciated.
Let me go a little deeper into that. In my understanding is that you are professor of psychiatry, and
That's right.
you're a medical director of integrative medicine at Stanford.
That's correct.
I find these two fields traditionally difficult to put together. But because Western medicine and integrative medicine has not always seen eye to eye on things. And
Right.
when it comes to hypnosis, I feel that somewhere neuroscience could be the bridge that connects the two. So I've
Mhm.
understood that you've done studies with functional MRI on patients undergoing hypnosis. So, what are the changes in the brain when someone's going through those stages of hypnosis?
I'd be glad to discuss that, Sid. We have used functional MRI. We've taken highly hypnotizable people and put them and compared them to low hypnotizable people and put them in the functional MRI scanner in states that are in and out of hypnosis. And it doesn't take very long. There's a misconception that you have to talk people upstairs and downstairs and take 20 minutes or half an hour. You don't. If people have the ability, three things happen in their brains. The first thing is in a hypnotic state, you turn down activity in the anterior cingulate cortex. The cingulate cortex is like a C on its ends, right smack in the middle of the lower portion of your brain.
Right.
And it's an alarm system. It does pattern matching, and it's part of what we call the salience network. So if while we're talking like this now, the phone rang, I had to shift attention and turn it off. That's my salience network saying there's something competing for your attention. We humans are pretty pathetic physical creatures. We're not very big. We're not very strong. We don't smell or hear that well. So we have to be alert all the time for the potential of predators. And if we weren't, we wouldn't survive. And so the salience network is part of the system that tells you you better do something to fight or flee or hide. And so when you turn down activity in the salience network, it allows you to get more absorbed in what you're concentrating on. You don't worry about what's going on in the periphery. You just intensify your focus of attention. It's like getting so caught up in a good movie, you forget you're watching a movie, you enter the imagined world. The salience network is also filled with receptors for inhibitory neurotransmitter, GABA, gamma aminobutyric acid. And we found that particularly in highly hypnotizable people, there's more binding of GABA in their receptors in the anterior cingulate cortex. So we have our own little internal pharmacy that dispenses the same neurotransmitter that benzodiazepines stimulate. So we can inhibit our stress response and our immediate reaction response with hypnosis very quickly.
Right.
The second thing is there's higher functional connectivity between the left dorsolateral prefrontal cortex, the executive control network, the part of my brain I'm hopefully using now with you, and the insula, which is a little, insula means island in Latin. It's a little island of tissue in the middle of the frontal cortex that is a mind-body conduit. It communicates from the executive control network to the body. So it's a way of helping us to regulate our body, to control autonomic nervous system, other parts of the body that we don't think of as controlling, but we do with our brains.
Right.
And it's also a site of interoception, a place where the brain becomes particularly sensitive to what's happening in the body. So we become more aware of what we're feeling in our body. So hypnosis is a way of intensifying mind-body perception and control. The third thing that happens is inverse functional connectivity. When one region is active, the other isn't, between the prefrontal cortex and the posterior cingulate cortex, the default mode network. It's a part of the brain where when you're not doing anything much, you're just thinking, you think about yourself. Who am I? What am I? What should I be? It's kind of the closest thing in the brain to the superego. You sort of look over yourself and say, who am I? What should I do? What shouldn't I do? And what's cool about this is that it's a kind of activity where you can try out being different. And so the very thing that scares people the most about hypnosis, some stage show hypnotist having the football coach dance like a ballerina, it's not a good example, not something I'd recommend. However, there's a point in it. You can just see what it would be like to be different. And that is a perfect setting for psychotherapeutic change, for accepting, depressive or anxiety-related perceptions of yourself, and see what it would be like if you approached the problem differently. If you saw a challenge like pain or stress or anxiety as an opportunity for mastery rather than evidence of failure.
Right.
And hypnosis can help people in a hurry reinterpret traumatic experiences, social defeats, other problems, and see themselves differently, see it as an opportunity. There's an old saying that when you come upon an obstacle in the road, it may be a road sign. It may point you in a direction you need to go.
Right.
So that's what we've learned about what happens. I mean, we've learned more, but those are some of the key findings of what we've learned about how hypnosis works in the brain.
That is fascinating. There was a question that came to my mind when you were explaining about the anterior cingulate cortex, which is the similarities, and correct me if I'm wrong, but the similarities with meditation, where chronic meditators or deep meditators have somewhat similar brain effects alongside with some decreased activity of the amygdala. Has there been any kind of similarities, parallels between these two?
The major similarity, Sid, is yes, there's some reduction in activity in the amygdala, which is a source of, anger, fear, pain, strong emotions. And, in meditation, you try to have open presence. You don't suppress emotion, but you also don't have to encourage it. And so you can kind of discharge it, just let whatever feelings happen and kind of flow through you rather than struggling with it, which is a good strategy. The main thing that's been found, two things in mindfulness meditation, is that number one, there is, in experienced meditators, decreased activity in the posterior cingulate cortex, in the default mode network. And, part of meditation is getting over yourself. It's coming to the Buddhist sense that our individual personhood is kind of an illusion, and we just connect with being in general. And you see that happening in the brain, that there's a reduction in activity in that posterior default mode network, posterior cingulate cortex. The other thing is some increased activity and even growth in the prefrontal cortex, particularly on the left, which tends to elevate mood. And so over time, there are these kinds of changes in people who are experienced meditators. And that's related to, but not the same as what happens in hypnosis. It's not so much turning down activity in the anterior cingulate cortex as it is these other changes.
Understood. That's really interesting. When hypnosis is considered in the context of clinical hypnosis or hypnosis as therapy, what
Yes.
what are the conditions that one should think of foremost as prime candidates for hypnotherapy?
Well, the most popular program we have on the Reveri app is for sleep, for insomnia. A lot of us have trouble sleeping. We need to sleep. It's a time when the brain is kind of doing some housekeeping, and the lymphatic system is clearing out, the remnants of synapses that are no longer needed as new ones are built. And people worry about, somebody said losing sleep is nothing to lose sleep over, but it is. It's not good for you. And so people find with hypnosis that we have an exercise where we have people imagine their body floating somewhere safe and comfortable, a bath, a lake, a hot tub, or floating in space. And whatever preoccupations, mental concerns they're having, they project them onto an imaginary screen as if they were watching a movie, but try to disconnect it from yourself and from your somatic reactions, so that rather than getting yourself all wound up about something, you just watch it as if you were watching a movie. And people find that that can be very helpful in getting them to sleep. It's the most used app. We have people, when in doing it for stress, which we do, we have people manage stress in a similar way, where if you're stressed, what tends to happen is a snowball effect, where you start to worry about something, and your body tenses up, and your heart rate goes up, your muscles tighten, you start to sweat, and then you think, oh my God, this is really bad, and you get more anxious, and then your body reacts to that, and on it goes. So we say, look, before dealing with the stressor, deal with the effect of the stressor on your body. That's something you can always control. So imagine your body floating in a bath, a lake, hot tub, or floating in space, and then divide the screen in your mind in two parts. On the left side, picture one thing that is stressing you, just one, not five, not 20, one, and keep your body floating and comfortable. So you're already beginning to control the situation because you're controlling the effect it's having on your body. And then use the other side of the screen to brainstorm solutions. So what might you say to your boss to deal with this problem? Or how will you handle the burden of work that's coming up by setting up an order in which you will address the problems one at a time? And so you use your visual imagination to picture how you might handle the stressor,
Right.
and at the same time control your body. So stress management, it's very helpful. It's good for helping to find your focus, to just narrow in on one thing at a time, and see what you can enjoy in pursuing and examining the thing that's causing you some stress. Because hypnosis helps you get into a state where you're more focused on the process than the outcome. A lot of people immobilize themselves by thinking, I have to get this done, and if I don't, this will happen, and that will happen, and the other thing. And what you're doing there is distracting yourself from what you need to do to actually get it done. So you want to immerse yourself in the process, the experience of it, see what would be fun about it, what you would enjoy in taking care of the problem you have to do, and do it, take care of it. So focus is very important. It's remarkably helpful for pain. And as I mentioned, Isdale in India, more than a century ago, showed that hypnosis is an extraordinarily effective tool for helping people to manage pain. I had a woman who was 7 months pregnant, had terrible lower back disease, and the bigger the baby got, the more her back hurt, and she couldn't use opioids, thank God, because she was pregnant. And when we started, her pain was 7 out of 10. And I had her imagine she was floating in a warm bath, which does give her relief. So you get your brain set in the same frame that it's in when you're in a warm bath. And the pain was down to 3 out of 10 from 7 in a few minutes. But she looked angry. And I said, what are you angry about? Your pain's better. She said, why in the hell are you the last doctor I got sent to instead of the first? I mean, they'd surgically implanted a nerve stimulator, all kinds of things that didn't work. And she was mad about it, and I don't blame her. So it is extraordinarily helpful for both acute and chronic pain. We found that women with metastatic breast cancer, who were taught to use self-hypnosis to filter the hurt out of the pain, to dissociate their attention to it, just the way, hopefully right now, you're so interested in what I'm saying that you're not feeling the sensations of your body touching the chair you're sitting in.
Yeah.
right? Good. I'm relieved to hear that. So we do it all the time. You know, it's not magic. It's simply the way our brain manages perception.
Right.
And there are some things you can and should and must pay attention to, and others you don't have to. And hypnosis can help you literally filter the hurt out of the pain.
Wow.
Hypnosis is also very helpful for habit control.
Mm.
Uh, we get people to stop smoking, to stop vaping, to eat more sensibly, and enjoy eating more while you're eating a diet that is better for your body.
Mm.
So there are lots of things, everyday problems that affect, you know, at least half the population of one kind or another. You know, a quarter of people in the U.S. have an anxiety disorder.
Mm.
Um, so a huge proportion of the population can benefit from learning to use self-hypnosis, and that's why we built Reveri, and it's there, you know, available in the App Store and in Google Play for Android phones,
Yeah.
and you can hear my mellifluous voice teaching you how to do those things.
I actually did. I downloaded Reveri a month ago, and I've been trying it out since a month. I've been using it
Huh.
for sleep, and
Have you? How's it work for you?
it's been pretty
Be
good.
very.
I have to say, it's been pretty good. I've previously tried different methods, and this has been a new one. And what has been interesting is that after a while, you kind of learn to do it yourself, and
Right.
you start wondering why you've never done this before. So that was
I love that.
so
That's a great question.
yeah, it
Yeah.
does. So I completely sympathize with your 7 month pregnant patient because
Yeah.
it does raise the question that why wasn't I aware of this before this?
Right.
You mentioned
Right.
that you made the app, you made Reverie because you were kind of frustrated with how long it's been taking, and you wanted to get to the public yourself directly.
Right.
I have a question that is it is there any difference in undergoing hypnosis when you administer it to yourself, as in self hypnosis, versus an app versus being with a clinical hypnotherapist in person?
Very interesting question, Sid. And I would say, to be a little provocative, that in fact, all hypnosis is really self-hypnosis. That all I'm doing is teaching people how to identify, assess, and utilize their own capacity to go into a hypnotic state. And so I don't, you know, I've used hypnosis with about 7,000 people in my career, and both as patients and also in studies. And what I'm doing is teaching them how to use an ability they have. And so there's no magic to it. I'm not controlling them. I'm teaching them a skill, how to use their brain better to help their problem. And so it's not, you don't need somebody else to do it. And it's the thing you said earlier is perfect. That is, I was showing you how to do it, and initially you were listening to my voice on the Reveri app, but after a while you didn't need that anymore. So you've proven the point that once you know how to do it, you can do it for yourself. So I'm just a guide there. I'm teaching you how to do it, one good way to use it to help with the problem you have, but then you do it for yourself. So
Right.
you've answered that question, that hypnosis is a skill that you can learn to use to help yourself. It's not something I have to be there doing to you. And I worried, Sid, particularly with insomnia, when we were building the app, it's interactive, which is fun.
Yeah.
So I ask, is your hand floating in the air? If it is, I go on to something else. If not, I help you with that.
Yeah.
So I tried to make it as much like being in the office with me as I could.
Yeah.
But then I thought, if you wake up at 3 in the morning and you need to get back to sleep, you probably don't want me in your bedroom telling you how to do it. And, and so it's really in some ways better because you got me whenever you need me, wherever you need me, just
Right.
all you need is your smartphone.
Right.
So it is not necessary to have someone doing it to you. You can
Also,
do it to yourself.
one
Yeah.
interesting thing I noticed was that as enjoyable as it is to hear your voice, I found that in my head after a while, when it was my voice, I kind of it felt even more familiar. And
Yes.
I wondered if there was any difference, whether it's better if you do it yourself.
Well, I think ultimately it's certainly more efficient, but it's an interesting point, Sid, and it may have to do with your level of hypnotizability.
Mm.
But it also, I think, has to do with turning down activity in the salience network. That is, there is a sense in which our level of kind of scanning awareness is a little bit stronger when another person is telling us what to do or how to do it. Because you're still thinking, well, who is he and what does he have in mind? And, is there something going to happen that I don't want to happen or something? Whereas hopefully that's not the way you feel about yourself. So, I think that your description is a good one. And I think if you can internalize it, you know where it's coming from and you know what the purpose is. And so I think it's even easier to accept it. But people can accept, and make rather remarkable changes with somebody else's voice too.
There are people on the other end of the spectrum who are skeptical or cynical about hypnosis for whatever reason. Suppose if you were to talk to them, or if I have to convince them, what do you think I should say?
And just say, open your mind and learn something. They can be skeptical. They're just depriving themselves and people who believe them of an opportunity to get better. And part of what I say is, okay, you think there's a problem with hypnosis, that it's either useless or dangerous or something. Last year in the United States, 88,000 people died of opioid overdoses. The CDC is expecting 111,000 to die this year, and most of them are not suicides. It's just accidental overdose deaths. Hypnosis has not yet succeeded in killing a single person. It just doesn't happen. The worst thing that happens is it doesn't work.
Right.
And so I would say consider the alternative, before you dismiss hypnosis, before you say it's some weird or dangerous or useless thing,
Right.
consider what people are doing instead and think again.
That makes that actually connects to some things that I already believe in, which is that pharmacotherapy might not be the only solution. Um,
Right.
and one of the problems is, of course, in the way that we are taught medicine while going through residency, where every disease is equated with a drug solution, a pharma solution. And even in my textbooks, things like lifestyle changes, diet, exercise are almost footnotes at the end of the chapter. It's just 2 pages of drugs and then 2 lines of lifestyle. And anybody who's been practicing medicine knows that lifestyle is so important. And self-talk, positive thinking, hypnosis, they don't even get mentioned. So there's a clear disparity in how we are taught.
Uh, I wish that weren't true, but you're absolutely right. And, and I'm a physician, I prescribe meds, but the sad thing is that there is a huge money-making machine behind these other treatments. Hospitals make the vast majority of their money, at least in the U.S., from surgery. I can always tell the social hierarchy of physicians at any medical center that the status of a medical specialty is inversely related to its distance from the operating rooms. And the big fancy offices and clinics are right near the operating rooms, and then you get out to pediatrics and psychiatry and all that stuff. And it's always like 5 buildings down at the edge of the medical center. And with pharma, I don't have a whole team of ex-cheerleaders going to doctors' offices telling them to use hypnosis with their patients. There isn't a lot of money to be made in doing it. And that's okay, but the thing is that there are tremendous financial incentives for doing surgery and prescribing medications. And as I say, sometimes that is the best or only thing to do,
Right.
but sometimes it isn't. And you characterize it very well, Sid, that it's always an afterthought, a footnote somewhere.
Yeah.
It's not the main thing.
Yeah.
And I'm frustrated about that. I just think we've got our perspectives out of balance here, and part of it is there's not a lot of money to be made in teaching people how to help themselves.
Right.
But there's actually a lot of health care improvement that can come with it.
Absolutely, because I mean, I do want to clarify that medical treatment, pharma treatment, surgeries have been nothing less than miraculous for so many patients. Of course, that
Right.
has a huge role to play in healthcare, but I think what we are both advocating for is more of a balance in the way that we
Yes.
approach healthcare.
That's exactly right. That's
Yeah, so
exactly.
there was one question that I had about you mentioned suggestibility, which brings me to the point of, is everyone hypnotizable? Is everyone a candidate for this therapy, or are some more likely to benefit than others?
Well, the answer is no and yes. Not people are not equally hypnotizable. It's interesting that there's a sort of human history component to it, in that basically all 8-year-olds are in trances all the time. You know, you call your kid in for dinner, he's out playing, he doesn't hear you. Uh, children are very hypnotizable, and we've used it. We did one study which we published in Pediatrics, a randomized trial of children who had to have voiding cystourethograms, and that's a terrible thing. And if you have reflux into the kidneys, if your renal artery is your ureter is not
Yeah,
connected at an angle
to the
to
bladder.
the bladder,
Right.
then you get reflux into the kidneys. And so it's a very clever thing. It's a natural valve if it's at an angle, because when the bladder contracts, you don't get reflux. But if there is, you have to have major surgery to get it corrected. So you have to, once a year with these kids, stick a catheter into their urethra and inject contrast. And it's a horrible thing. You know, you're a 9-year-old girl with your legs spread apart on a cold table, and it's terrible. And the more, of course, you fight, the harder it is. So I taught mothers to teach their kids self-hypnosis, and they would go play at a friend's party or something, and they got done 17 minutes quicker. And that's a long 17 minutes for these kids. And the techs doing the procedure found it much easier to do with these kids. So children are very hypnotizable. What happens as you get into adolescence is we learn what are called formal operations. We learn to think more with logic and analysis than we do with just primary experience. And so by the time we get into our 20s, we've settled into a degree of hypnotizability that is as stable as IQ in adult life. And so about 20% of the population is just not very hypnotizable. 20% on the other end is extremely hypnotizable. They're in hypnotic light states all the time, and about 60% kind of come in and out. So we call the lows the researchers, the highs the poets, and the people in the mid-range the diplomats. They have the experience, they step back and think about it. So it means that the majority of adults have enough hypnotizability to use it. And even the ones who aren't can affiliate with the way we approach problems, because, you know, people who use hypnosis say to one another, the worst thing you can sell someone is, don't think about purple elephants. You know, what are you going to think about?
Of course.
So you focus on what you're for, on positive reinforcement. You find ways to feel good about what you're doing from the moment you're doing it. And if you're also hypnotizable, you get a lot more bang for the buck doing it that way. But even if you're not, just taking that approach to problem solving can be helpful. So we have a test for hypnotizability on Reveri. You can find out in about 6 minutes how hypnotizable you are, and work that into the way you approach
Right.
the problem you're dealing with.
Right. I know that in the app, you've covered different kinds of problems that people face. One of them is sleep, as you discussed. One of them is sort of anxiety, overthinking, if being able to focus better. I wanted to ask you about those problems taken a little bit further along the clinical path. So, for example, ADHD. Um, would somebody with ADHD benefit from hypnosis, being able to calm down enough to focus better?
Well, it's certainly worth a try. I've done some work with people. It's not been a specialty of mine, but you're right that sometimes the sort of anxiety or kind of cognitive rigidity that comes with ADHD can be helped. I would say for people with mild to moderate ADHD, it can be helpful in just helping them, keep a more consistent focus on what they're doing and how they approach problems and being more systematic and less kind of rigid about how they deal with problems. I wouldn't say it's a primary intervention for it, but there's no harm in trying. And for some people who have mild to moderate ADHD, I think it can be helpful.
Right. Has group therapy or group hypnotherapy worked? Is it effective?
Oh, absolutely. I've used it in groups. It's it's more efficient. I ran groups said of women with metastatic breast cancer, and we would end each group with a self-hypnosis exercise. So they were weekly group meetings. They would deal with their anger, fear, and sadness. They would provide models to one another of how to cope with the illness, and they could see things in the woman across the room that were true about themselves, but they couldn't see within themselves. And at the end, we would, we often lost women in the group. We would have them grieve the loss. Picture in an imaginary screen on the one hand the woman who just died and how you're feeling about that, just experience your sadness and grief. And on the other hand, on the other side of the screen, picture one thing she left with you. What was her gift to you that is still with you, even though she's gone? And that's reassuring in several ways. You realize you haven't lost everything. You also realize that you are giving gifts to other people that will remain with them even when you're gone. And we taught them to do self-hypnosis for pain control. And so they would go into, they just, as you did, they didn't, that was before Reveri, so they would have to remember how to do it. And if they felt a new pain in their chest, their default reaction was, oh my God, the disease is spreading. I'm going to die sooner. It's new metastases. And they thought, no, this is just some discomfort in my chest. I've felt it before. And I'm going to take a warm imaginary bath and filter the hurt out of the pain. So they saw it as an opportunity to use a new skill they had to make themselves more comfortable. This was a randomized clinical trial. By the end of the year, the women who were taught the self-hypnosis had half the pain the control group did on the same and very low amounts of medication. The pain got worse in the control group, got better in the treatment group. So yes, absolutely, group hypnosis can be very effective.
This sounds like a very effective way of autonomic regulation where somebody is in a hypersympathetic state and
Right.
hypnosis can be used to bring them into a parasympathetic state.
Yes, I think so. We don't have evidence yet, but we think that things like heart rate variability, which is a sign of parasympathetic activity, can increase. And we're doing some breath work exercises, which we have on Reveri as well.
Yes.
Cyclic sighing in particular, where you emphasize the long, slow exhale through your mouth. And as you increase pressure in the chest, you increase venous return to the heart. And that tends to trigger parasympathetic rather than sympathetic activation.
Right.
And parasympathetic activity is very important when you go to sleep. That you need parasympathetic dominance, not sympathetic dominance, to get to sleep.
Yeah.
And so it absolutely is related to the ability to regulate and control your capacity to become more parasympathetic than sympathetic dominant and relaxed.
I think that makes sense. Just putting it into the objective markers of electrobiology, you can explain it in a better way.
Absolutely.
This is one of the final questions that I had for you, doctor, which is, if I, as a neurophysician in India, or any of my colleagues who will listen to this podcast, if they want to start using hypnosis for their patients, is there a path forward for them?
The path is a 6-letter word, Reveri. And I understand you have a lot more Android phones and less Apple phones in India. So you can if you have an Android, we have an Android app. You can get on Google Play, or you can go to www.reveri.com to get more information about the science and how the app works and find out how to download it. And give it a try. You can hear my voice and look at the different problems you can address using Reveri and get help with as you did, your insomnia, your stress management, your pain, your habit problems, phobias like fear of flying, You can learn to use self-hypnosis to deal with that problem, and you can use it multiple times a day. And after a while, you can just, you become familiar with it enough that you don't need the app to do it. But Reveri was designed for people who have not had experience with hypnosis before. It's fine if you have, but it's a way of teaching people what hypnosis is and how to use it to deal with your problems, and try it and see if it in fact helps you the way it helped you.
Amazing. I'll be putting the link below in the description.
Great.
Dr. David, thank you so much for joining in. If you have any parting statements for my audience, please feel free to share.
Well, it's been my pleasure. I thank you very much for having me, Sid. And I would say that I think, hypnosis in a way is where, sort of West meets East. There are long-standing meditative and other traditions in the East, like in India and elsewhere. And hypnosis is a more recent, but still a rather old by Western standards tradition. And it is similar in that you're changing your mental state and you're using that in a deliberate and constructive way to help enhance your ability to deal with problems that you have in your life. But we think of it as a tool to use to solve a problem. So hypnosis is kind of more like, an aspirin, a painkiller. Mindfulness is more like a vitamin, something you do every day to enhance your well-being. They're both good. They're related but different traditions. And I would be delighted and honored if in India people try out this version of an altered mental state tradition and see how much it can be of help.
I hope we do. And I, for one, am excited to try more about this. And I'll be talking
Great.
more about hypnosis on my channel because I know that people are interested. So this conversation is a great starter for that. Thank you so much, sir.
You're most welcome. Thank you for exploring it, and I'm delighted to be here with you, Sid. Keep
Thank
up
you.
the good work.
Thank you. Bye.
Bye.
That was my podcast with Dr. David Spiegel, the founder of Reveri, the world's first interactive hypnosis app. If you enjoyed that conversation, hit the like button, subscribe to my channel to learn more about neuroscience and health, and I'll see you in the next video. Bye everyone. Take care.